has signed into law the National Health Insurance Bill at the Union Buildings in Pretoria. Government says the NHI Act will change South Africa's healthcare system and ensure universal coverage for health services. Ramaphosa says the challenge in implementing the NHI is not funds, but in the misallocation of resources that favors the private sector. The bill was heavily criticized by various political parties, businesses, as well as health practitioners over the years. Although some sectors have welcomed it, it took 4 years before the bill was finally passed by the National Assembly after extensive public participation. Of course, that issue of participation was also raised a little bit earlier on. Let's now bring in the CEO of RH Managers, and that is Mr. Quinton Zunga. And of course, they are joining us for reaction. Thank you so much for your time. So majority of those, that were or are opposed to the NHI, including those in the health fraternity, say they're not necessarily opposed to the, the concept of universal healthcare, but the concerns are really centered, and I said this before, around aspects of the Act, especially around the vague funding model. Just your reaction after having listened to President Cyril Ramaphosa as well as the Health Minister. Please can you unmute?
Okay.
Thank you.
Yes.
Continue. You are unmuted, Mr. Zunga.
I'm unmuted. Can you hear me?
I can hear you perfectly. Continue, sir.
So the key thing that came out for us, the first thing was the intent, which is to bring in the excluded population from quality healthcare. But important was also that everybody realizes that it's a phased approach. I think everyone was expecting a big bang and criticized that it can never happen. But in a phased way, it is possible. And we want to be supporters of the phased approach if it's taking 5-8 years going forward. So we really like the tone of approach that you can still use your private medical aid until they get it right. And that is a very different, because the Act almost kind of outlaws it day one, sorry about that. But we think there's accommodation to work together with the public sector, and that will ensure a transition. For us as healthcare asset owners, as RH Bophelo, we want to provide our assets for NHI. We're looking for that partnership and the models moving out of the pilots into specific areas that the minister talked about, that we can start with maternal benefits, going down and doing add-on. We are ready for that, and I think this should be welcomed by everybody.
So just for the benefit of our viewers then, he spoke about 2 phases, and he says, in fact, the first phase, which is a 3-year period, already started in 2023. He says this period is between 2023 and 2026, and that speaks to the acceleration and the improvement of the healthcare system on the ground. So apparently that's going well so far. How convinced are you that that is the case? If this started in 2023, there's still quite a lot of work cut out for government, because if you look at it, we are talking here about, just budgeting. From a National Health Department's perspective, where there's been significant cuts there, and also funds not being allocated where they should be. There's also issues of resources that are fundamental. And also, of course, when we look at infrastructure development that is much needed there. The second phase, of course, is a phase where you would possibly come in, where government is basically saying that it is a continuation of phase 1, but it's also actually the implementation of the NHI, where contracting of services then begins. But how confident then should South Africans be, even though we are being told that this may not necessarily take, a few weeks or months, it will take years. But the issue of funding is still there, in as far as who is going to pay for this, how much are people going to be taxed for it, and will it address some of the issues that I've just mentioned now, in as far as what's happening on the ground?
Yeah, so I think, yes, it is a complex situation, but one needs to realize we have to start somewhere and go stepwise. The important thing to think about is the pilot stage was very small. So yes, that could go wrong. Doesn't necessarily mean if you now apply it to the whole country, it's going to work as well. So our view is the current dispensation has seen provincial governments contracting with the private sector, paying for those services. That should be elevated to the first benefits available because it is already happening. Now, there is a fundamental issue which hasn't been really dealt with, is at what price does the government contract with the private sector, and at what price do they pay their own infrastructure? There needs to be a holistic and a national pricing methodology agreed. And in fact, the pricing methodology is not really a service rollout. It's really the setting up of the institution, which the minister said, well, let's set up the institution that determine prices, determine all of those things, and then we come after. So a lot can be done without necessarily rocking the boat. But if we declare step one, it allows all of these things to follow, as long as the partnership is existing, that if the government is not ready, they shouldn't force it, they should allow for the equilibrium to change slowly. So that's the confidence we need, because everyone was expecting that everything just blows up in day one and we start to have a bigger problem.
What about those that are so against this act that they are in fact lining themselves up to go to court head to toe with government? I mean, we are sitting at around 5 to 6 entities that are already saying that they will be challenging government in court in as far as this particular act is concerned.
So we've got to be careful for special interests. I'm in the private sector. We are in the private sector. RH Pupilo has hospitals in 8 of the 9 provinces. But we can certainly tell you that the private sector is not perfect. We certainly feel, as a new black-owned healthcare company, we've been excluded from DSP, designated service provider networks. And there is no transparency. So when people who have interests are pursuing a certain protective measure, one can understand what is going on. And they are part of the kind of benefiting from the current infrastructure. And of course, if there are things to critique around the bill that needs to be challenged, is fine. But there are extremely a lot of interest in healthcare that one needs to look beyond this, the contestation, into why are they contesting? Because on a holistic, we all agree that health is a reasonable right for everybody, and that if you don't take care, as we saw in COVID, you can't be healthy alone. They are communicable diseases that everyone suffers from. So the overarching is agreeable, is the interest, and we need to say, as a developing country, what works for us and start somewhere.